Hi everybody, I'm RAÚL CHÁVEZ and I'm going to present our poster named A Very Dangerous Dress. Here we present a case report of a woman of 36-year-old with a history of rheumatoid arthritis and psoriasis. She was admitted to our hospital because she was taking treatment with methotrexate, but she had to change this treatment to sulfasalazine and hydroxychloroquine 3 weeks before the hospital admission because she couldn't find the drug since the beginning of COVID-19 pandemic. On March 6, she got tattooed in her left arm. 2 days after the procedure, she began with hives, initially at the tattoo region, but then the lesions were disseminated to thorax, back, and shoulders. On March 12, she went to our emergency room where she received the diagnosis of urticaria and sent home with antihistaminic. Next day, she came with a generalized dermatosis. Moreover, the emergency physicians examined her. Again, she had hypotension and stridor, so she received 0.5 milliliters of epinephrine with resolution of the anaphylaxis. The skin had generalized hives, alternating with morbilliform exanthema and atypical target lesions that paled to pressure, and in the left arm she had multiple pustular lesions. The dermatology team did a cutaneous biopsy. Moreover, the patient had cervical lymphadenopathy. The labs showed leukocytosis with neutrophilia and lymphocytosis. Also, she had hypertransaminasemia, and we made a preliminary diagnosis of purulent severe soft tissue infection and severe cutaneous drug reaction syndrome. So we began treatment with piperacillin tazobactam, vancomycin, and prednisone. So during the hospitalization, she cursed with eosinophilia, and a peripheral blood smear showed atypical lymphocytes. We calculated a Registrar Group diagnosis score of 6 points, so we concluded DRESS syndrome, probably secondary to sulfasalazine. The protein chain reaction of plasma test was positive to Epstein-Barr virus. The blood and skin culture were negative, so we suspended antibiotic treatment. The cutaneous biopsy showed lymphocytic infiltration of the dermis. The skin lesions and transaminasemia improved after 5 days of treatment with a steroid. She went home with methotrexate. The patient's family finally found the drug, and in the outpatient follow of the skin lesions and hypertransaminasemia, both were fully recovered after 1 month. In conclusion, the DRESS syndrome is a potentially fatal severe cutaneous drug reaction with multi-organ involvement. The prompt diagnosis and exclusion of other etiologies are the basis of a properly management and the best method to prevent possible complications. Thank you.